Allison and Andrew were excited to welcome their second child into the world. They were told that they should expect a little girl, based on Allison's ultrasound images. They were happy to have a second daughter join their first, a 6-year-old girl named Daisy. The nurse in the newborn nursery informed Allison that it was important to perform the newborn screen assessment so they could identify potentially critical health conditions early and intervene appropriately. When Daria arrived, she had a little prick in her heel to collect a sample of blood for a newborn screening card, called a Guthrie card, used to screen for different inherited disorders. However, when the results of Daria's newborn screen returned, Allison and Andrew were informed they would need to talk to their pediatrician, who referred them to a specialist known as a clinical immunologist, a specialist in diseases of the immune system. Apprehensively, they sat down with Dr. Butterworth, who explained that Daria had an abnormal result on the newborn screen for a condition called severe combined immunodeficiency, SCID, which would be life-threatening if not treated early with a bone marrow transplant. Allison and Andrew were devastated as they digested this news, but they were also given hope that significant advances had been made in early diagnosis and treatment, and that Daria had a good chance for survival. Dr. Butterworth said Daria's transplant would be managed by the pediatric hematologist and a team of specialists to ensure that she had the best care possible. They returned home and every precaution was taken to protect Daria from infection and avoiding vaccination with live but weakened virus vaccines. Dr. Butterworth explained that if Daria developed any sign of infection or illness, she should be brought to the hospital immediately. Allison and Andrew explained to Daisy that her little sister was very sick, and she could potentially help Daria recover her health by getting her blood tested to see if she would be a match for a bone marrow transplant. Andrew and Daisy set off to the hospital to get Daisy's blood tested for matching purposes. Daisy bravely endured the needle stick for blood collection in the hopes of helping her sister achieve a cure and become a playmate. Dr. Butterworth informed Allison and Andrew that Daisy was a match for her sister and would be a suitable donor for a bone marrow or hematopoietic cell transplant for Daria. Daisy was scared but also excited to hear the news from her parents. She returned to the hospital where her bone marrow was collected and the stem cells stored to be transplanted into Daria. The day of Daria's bone marrow transplant was almost anticlimactic when she lay quietly receiving the precious stem cells from her older sister with her entire family in attendance, after appropriate preparations and precautions had been made. Dr. Butterworth and the transplant team visited with the family and reassured them of careful follow-up over the next several weeks and months to ensure the transplant was indeed successful. Daria continued to make steady progress and met the necessary milestones in her post-transplant course, and soon, she was celebrating the 3rd anniversary of her transplant running and playing with her older sister, who had given her a new lease on life. Allison, Andrew, and Daria met with Dr. Butterworth and expressed their keen gratitude for newborn screening, which identified a critical illness in their child before she became sick, allowing for early and rapid treatment to be initiated. They recognized that newborn screening saved Daria's life, and they promised to be active advocates for newborn screening for SCID so that other families could also experience hope and have a chance for a positive outcome.